3 minutes.
I lost my son to mental illness.
That's how long Sherry Unwala was given to talk to Forsyth County commissioners.
He took his life.
About her son, Carl.
When he was sick, we had no place to turn to.
It is so hard. You're telling your story, but then you feel they're not listening.
We're all saying the same things, and yet it still is getting just skirted over.
Elizabeth Johnson, who works with at-risk girls in the county, has also been pleading commissioners to move forward with a plan to build a mental health crisis center.
We have no facility to take them to.
We are in a crisis.
Commissioner Cindy Mills says the plan for the whole health center, which would have 31 beds for adults and children who are in the midst of a mental health crisis like suicidal thoughts or self-harm, was voted through unanimously 8 times over 3 years.
The county plans to build a cutting-edge 57,000 square foot public health facility.
With nearly $3 million taxpayer dollars already invested. About $30 million in federal COVID funds would cover the rest.
It was almost like manna dropped from heaven because it was something not expected.
There are so few mental health beds available in Georgia, most people in a mental health crisis are just sent to the ER, like Sherry's son.
He was crying. They just said mental issues and just labeled him and sent him away. He came home and within a few days he took his life.
The whole health center seemed to be a solution. But Mills says in the last few months, her fellow commissioners suggested putting the money elsewhere.
Why wait 3 years to bring it up? I believe that it's the stigma.
A stigma stakeholders like Mary Schaefer with the National Alliance on Mental Illness says was fodder in the May primary election.
This is false. It is not a mental institution. It is a crisis intervention center.
Chairman John, can we try to catch you after executive session? Outside.
Commissioners John and Simonson declined to be interviewed by 11 Alive Investigates after the last board meeting before the election.
Can you tell me when you changed your mind about the whole health building?
That's not really an accurate depiction of what
would be more accurate?
County spokesperson Russell Brown confirmed the board is investigating alternate options for the COVID money, like investing in water and sewer.
A lot of infrastructure options, and all of those have been vetted, investigated, and looked at to see what the right options are.
If all of these options have been vetted and investigated, how come none of them have been brought forward in meetings yet? This is the first time I'm even hearing about this.
Yeah, so there's been a lot of discussions internally with the county on that.
Advocates fear the time has passed to save the project.
What hope is there that this can happen in the future with taxpayer money?
Never. Never. This is our one shot.
3 minutes. The time allotted for a mother's plea.
They just have to look at us and listen to us and know there is a need.
The exact length of this story. And time's up.